dama koy wax saa su ne ku ne ak li nga def.
ñun liñ war a def tey ñu jéem a consolider suñ souveraineté réew nag su taxawee ci kaw dëgga fu mu dem mun naa ekkiti boppam man dem ma ci UDP pour you fi post or anything. We need a port of 3 miles long and we can build it. Gis naa Jammeh many times rongoñam yi di génn. We are all detribalized Gambians. But foogu ma ni Kangara fi mu nekk comfortable na. Gambians dañ foog ne soo àggee retirement age rek da nga war a jël sa kurus dem toog ci jumaa ji di wirda. For some reason mu link up again with Baba Jobe mu may ko pajoor bu bees pul. Yaya Jammeh allowed me ma dem to 16 heads of state. Yàlla daf ñu may loo xam ne mayu ko benn réew ci Africa. None of them understood. Even Minister, he gave me a passport, a diplomatic passport for 5 years.
Doctor, ñu bari ñu ne musul na wona musa dégga UDP.
Yes.
Musul ta dégga sa gémmiñ nga aussi UDP.
Okay.
But doctor, all of a sudden.
If you want to receive monies from UK, Europe, USA, Canada, Switzerland, and the rest of the world, Supersonic's money transfer has got you covered. With the largest payout network in the Gambia, you can now receive your monies anywhere you are, from Kartong to Koina, with less hassle. Yes! You can receive monies from your family and friends in UK, Europe, USA, Canada, Switzerland, and the rest of the world with our safe, secure, fast, and convenient service that offers you the largest selection of payout locations in the Gambia. Supersonic's money transfer. We are currently in 34 African countries and counting, giving you quality money remittance services that are second to none. Visit the Google Play Store or the Apple Store today to download the Supersonics Money Transfer app and enjoy excellent money transfer services only with Supersonics.
Not likely. Yes. So men can get breast cancer as well. As long as you have a breast, you can get breast cancer. And like Muna said, the more breast tissue you have, the higher your chances. That's why women tend to have a higher risk of breast cancer. But there are men who can get breast cancer. And when a man gets breast cancer, you know it's bad. You know why? Why is a man getting breast cancer worse than a woman? Yes. Excellent. So that's Salima, right? Yeah, that's a great answer. So basically, it's just the size. So, I mean, a man has a smaller breast. So if he has a lump, the lump is likely to touch the chest wall faster. With a woman, they tend to have bigger breast volumes. So as a result, the lump would be there, and it will have to grow to a very, very big size before it starts spreading to other parts of the body. So obviously, a man getting breast cancer is worse than a woman. Another one, which of these have been proven to increase your breast cancer risk? Your mobile phone, underwire bras, your deodorants, your sprays, breast implants, all of the above, none of the above. Any volunteers? All of the above. What spray are you using? Or what deodorant are you using? Who answered the question? I can't. Who answered the question? Yes, all of the above, meaning all these can increase your risk of breast cancer. Then we should stop using mobile phones, since it increases the risk of breast cancer. So if you Okay. So in this presentation, we'll see what increases. There's what you call risk factors that increase your risk of breast cancer. But amongst these, none of them are risk factors for breast cancer. Okay? So the correct answer would be none of the above. There's a notion that bras increase your risk of breast cancer. Is not true. The spray that you use, the deodorants that you use, they do not increase your risk of breast cancer. So there are 5 questions that I would like to answer at the end of this lecture. And if you're able to answer these 5 questions, I would consider my job to have been done. Number 1, what is breast cancer? Number 2, how does one get breast cancer? Number 3, how does one confirm that you have breast cancer? Number 4, what do you do if you have breast cancer? And number 5, how do you treat breast cancer? Okay, so these are the main things that we're going to go through. I've been told that I have about 40 minutes. I'll try and cover everything as much as possible. This is a topic that I'm very passionate about. And I'll try and be as complete as possible and as explicit as possible. So my first question was why October? Now we know why. We have a whole month to breast cancer because it's frequent. What is breast cancer and how frequent is it? Breast cancer, if I'm to explain it, I would use this. If you're building a house, which wall do you want on your house or your gate? Why don't you want this one? It can fall at any time. Okay, so this is a very organized brick wall. Okay, this one, not so much. You have things falling apart. It's really not organized. This would be a normal breast, and this is breast cancer. Your body, as you all know, are made of tissues. Further down, what do you have? Your cells. So these are your cells. So they're structured units that are well organized and well arranged. When you have cancer, your cells become abnormal in their function and in their size, and they become uncontrollable. Your cells normally grow at a particular rate, and then they die, they're replaced by new cells, and that's how your body functions. With cancer, the cells refuse to die. They become rebels. So they're there, new cells are coming in, and they're very disorganized. So that's generally the definition of cancer. When it touches a particular part of your body, then that becomes cancer of that part of your body. If it's the brain, it's brain cancer. If it's the liver, liver cancer. If it's the breast, it's breast cancer. So that's how breast cancer looks like. It's the most common cancer amongst women worldwide, around the world. But in the Gambia, it's not. We'll look at what the first cancer is. This is statistics from America. 1 in 8 women would develop breast cancer in their lifetime. That's a 12% chance. Every woman has a 12% chance of developing breast cancer. It might not seem a lot, but it's significant, right? So I mentioned that breast cancer is the most common in the world, but it's not the most common in the Gambia. Does anybody know what's the most common cancer in women in the Gambia? Exactly, cancer of the cervix. So breast cancer comes in second place, but it's still very frequent in the Gambia. So it's still relevant. We need to create awareness for breast cancer. In the world, you can see breast cancer, we have a higher proportion in the West, in the Northern Hemisphere. So that's America, Canada, and Europe, and lesser in the Southern Hemisphere. But I'll be very, very careful about these statistics because we are not reporting our cases. How many breast cancer cases are staying at home and going to the marabouts for treatment? How many of them go around before they get to the hospital? So our breast cancer patients are not coming to the hospital. And you know why? Anybody know why? There's stigma, number 1, but more importantly, they're not aware. There's no awareness. A woman has a lump on her breast and she thinks it's normal because she's breastfeeding, and she wouldn't come to the hospital. So we are underreporting our statistics. Okay, I think we have as much cases of breast cancer in Gambia or in Africa than you have in America. It's just that they're reporting and diagnosing it quickly and at an earlier stage. So this is a little bit of anatomy. The breast is composed of different components, fatty tissue, but mainly breast cancer affects the ducts and the lobules. Those are the main parts of the breast. Okay. Breast cancer starts off, like I said, the lobules and the ducts. You have cancer of the breast cancer that can eventually move from the breast and go to the next position or the next station, which is lymph nodes. Do you all know where your lymph nodes are? So the closest lymph nodes you'd have are under your armpits. And this is very important when you examine women for breast cancer. You should also examine the armpits. It's an extension. Okay? So how does one get breast cancer? Anybody know? Are you born with breast cancer? Is it transmitted? Does a husband get cancer from his wife if the wife has breast cancer? So how does somebody get breast cancer? Sorry? So what are the risk factors that you know of? Okay, I'm seeing hands. Yes. What risk factor? Sorry? You have to speak up a bit. Genetics. So it runs in the family. Hmm? Okay. Anything else? You had your hand up? Age. So is it younger patients or older ones? Older ones. Okay. So age is a factor. Anything else? We just mentioned one, an obvious factor. What did we say at the beginning? The most obvious. The sex. So female sex is a risk factor. Being female is a risk factor. That's one of the most important factors. All right? What else? Yes, Tita. Hmm? Stress. Okay, I hope nursing students are not stressed. Stress, yes, in a way, indirectly, it can cause some reactions in your body. Yes, behind. Sorry? Radiation exposure, that's a good one. Yes, and how can you be exposed to radiation? Is it the sun's radiation? That would be an African thing if it was that. What radiation? Hmm? How much radiation do you have here from a mobile phone? Exactly. So the radiation that you're exposed to is X-rays. X-ray machines, CT scans that we do here. But another type of radiation we don't have in the Gambia, which is nuclear, for example, or radiation from industrial complexes, people who work in places where you have a lot of radiation, atomic energy that's being produced. Okay? So again, this is something I'll briefly talk about because it's important. I mentioned cells. What happens is you have healthy cells, and then the cells become damaged, sometimes due to genetics, and those cells become mutated. You know what mutation is? Okay. And then from mutation, those cells stop obeying. It's just like when you have the police, and then everybody is following the police, and then you have a rebel who decides not to listen to the police. So they go anywhere, they disrupt traffic, they refuse to fall in line. So that's how cancer is. And that's why when you see cancer, it doesn't have any particular shape. It just grows in any funny form because the cells are growing in anarchy. There's no organization. So those mutated cells, those cells that undergo mutation, tends to divide. So they grow bigger and bigger. And what they do is they start eating all the food in the body. And then the healthy cells have nothing to eat. So somebody in late stage of cancer, what happens to them? How do they look? Has anybody seen a cancer patient? Yes. How did he look in late stage? I can't hear you. No, I'm just saying, how do cancer patients look? I mean, their appearance. How do they look? Somebody with late stage cancer, what is the first thing that strikes you when you look at that person? Are they big? Are they small? Are they fat? How are they? They lose weight. Exactly. So because the cancer cells are eating up all the energy and the food, your normal cells don't. So they tend to look small. So that's explained by the growth in mutated cells or the cancer cells. Okay. So cancer of the breast, there's one particularity, it's hormone sensitive. And that explains why it's more in women. What hormone do women have more than men? Estrogen. If you understand this concept, then you would understand all the risk factors. There's a reason why I'm emphasizing on this. Okay? So it's based on estrogen and progesterone, mainly. Okay? So this is produced mostly in women. And because it's produced mostly in women, breast cancer is more frequent in women. So your risk factors, you can divide them into two. You have modifiable and non-modifiable ones. Ones you can do something about, others you can't do anything about. Okay? So the ones you can't modify is your age. Somebody mentioned age. The older you grow, the higher your chance of getting breast cancer. It's much more likely for a 50-year-old to have breast cancer than a 30-year-old. Okay, it doesn't mean a 30-year-old can't have it, but the chances are higher for a 50-year-old. Gender, that's the most obvious. Women have more chances of getting breast cancer. Family history, you have an aunt, you have a mother who has breast cancer, chances are that individual has a higher risk of getting breast cancer. Genetic changes, your genes, there's a particular gene. Have you ever heard of the BRCA gene? BRCA 1 and 2? No? So these are specific genes that have been identified to be breast cancer genes. So anybody who has that mutation would have that cancer. Menopause and menstruation, or menarche, meaning that a woman who starts seeing their menses, or a girl who starts seeing her menses instead of at the age of 12, 13, they start seeing it at 8 and 9. They're exposed to hormones. Again, this is a very hormone-dependent cancer. So if the woman starts seeing her menses maybe at 8 and then has menopause, means stops seeing her menses at 55, then she has a very long period where she's exposed to estrogen. So she has a higher chance than somebody who has a menstruation that starts at 13 and menopause at 40 or 45. So the longer you're exposed to hormones, the higher your chance. Like we said, it's a hormone-based cancer. Breast density. Women who have denser breasts have a higher chance of getting breast cancer. And your race, it's found that blacks tend to have a little bit higher incidence of cancer than whites. Okay? So those are things you can not do anything about. You can't change your sex, although some people try nowadays. You can't change your age, you can't change your weight, you can't do much, okay? But there are things you can do something about. If you're overweight, you try and reduce your weight. Because the fat cells in your body are converted to estrogen. And estrogen, we said, is a risk factor, right? Physical inactivity is related to being overweight. You're overweight, you're not moving around, you come to school, you sit on your benches, you sit in your car, you go home, you sit on your couch, so you're really not moving. So inactivity is not good. And this is not just for breast cancer, but it's for all types of cancers. Alcohol consumption is not very common in this country, but it still increases your risk. Hormones, a woman who goes to menopause, 50, 55 years, she starts having hot flashes. She's having symptoms of menopause. She starts taking hormones. Again, it's a hormone-dependent cancer. She increases her risk of getting breast cancer. The things that protect you. Pregnancy. This is when your mothers and grandmothers tell you early marriage. Well, there's a campaign against early marriage. But this one is for not early marriage, but at least reasonable marriage at a reasonable time. Wherein pregnancy actually protects a woman from breast cancer, okay? So a woman who has had multiple pregnancies is at a lower risk of getting breast cancer than a woman who's never had children, okay? Breastfeeding is not just good for the child, but it's also good for the mother. So when you breastfeed, you would reduce your chances of having breast cancer. And then radiation or radiotherapy, as we mentioned, is something that would increase your chances of having breast cancer, okay? So I would just say one thing. Risk factors don't mean that you're going to get it. Just because you have somebody in your family who has breast cancer doesn't mean automatically you're going to get breast cancer. If you look at this chart, only 30 to 40% of those with known risk factors actually get cancer. The large majority, 60 to 70, have no risk factors. So what that means is, because you have a risk factor, doesn't mean that you're going to get cancer. It just means you have to be more careful. But on the other hand, if you don't have any risk factors, it does not mean that you won't get breast cancer. So women, whether you have risk factors or not, you need to screen. You need to check yourself to make sure that you don't have any signs of early breast cancer. So how do you know? 8 out of 10 lumps are not cancerous, so this answers one of our questions. You need to be examined by a healthcare professional, and then investigations are done. You will not know which lump is cancerous and which one is not, unless you go to the hospital. Most cancerous lumps are painless. Like I mentioned, breast cancer does not pain at an early stage. Some of the things you would see: skin changes. You can have a palpable mass. This is the most common we see. We have a breast clinic at the Efsth, and when women come, the most often they will complain of a palpable lump on their breast. You can have nipple discharges. When it's a woman who's not breastfeeding, they have blood that's coming out. Blood is never normal in the nipple. So that may also be a sign of breast cancer. We talked about lymph nodes. So under the armpits, you can have enlarged lymph nodes. You can have what's called an orange peel appearance. So this is also a sign of breast cancer. And this is actually advanced breast cancer. We see a lot of these in the clinics, unfortunately, because of late presentation. You can have skin retractions. So a woman who sees that part of the skin is retracted would also have to get investigated to make sure there's not breast cancer. This happens when the lump is inside and it's pulling on the skin. So this can also be a sign of breast cancer. You can have inflammation, meaning that it's red, the skin is red, abnormally red compared to the other side. You can have nipple retraction. The same way you have skin retraction, you can have the nipple that's also retracted if the lump is next to it and pulling onto the nipple. You can have a very, very advanced one wherein the whole breast is reduced in size, hard, and retracted. So these are very, very advanced stages of breast cancer, okay? And we would want to make sure that we don't get to this stage. We want to diagnose cancers at early stages where it's a very tiny, small lump that can be easily treated. So nipple changes we talked about. So how does a woman know? Your nurses, future nurses, I think your job is very important and your role is very essential. I was just asking Salima at some point whether this nursing anthem, I think it's a great thing, by the way, whether it was something that was international, and she mentioned it, and I agree with the words. I think nurses are great and nurses are caring. And I think when it comes to breast cancer, nurses play a very important role in disseminating and creating awareness. And I would like to congratulate the Nursing and Midwife Association for organizing something like this. I think if we're able to collaborate with the nurses and have sensitizations in the different communities, it would make a huge impact on the type of patients we're seeing and the stage we're seeing it at. There was a study that was done in India, which is a low middle income country like ours. And they realized that we cannot adopt the same methods that are adopted in Western countries like Europe, America. They have the facilities, they have the financial muscle to do mammograms for everyone. A mammogram is an x-ray of the breast. We don't have that facility. Does anybody know whether we have any mammograms here in the Gambia? Okay, in Buffalo and in Medicare. Well, so you can see a population of 2 million, you only have 2 mammograms. And I think one of them is not working right now. So if you want to screen all the women with mammograms, you're not going to get far. Okay? So in India, what they realized is that in order to reduce the number of cases, of advanced cases, what they did was the nurses in the different communities were taught how to do clinical breast examinations. And once they know how to do these examinations, they know what to look for, the numbers of advanced cases dropped drastically. And that is a practical approach that can also be adapted in our country, because the rates and cases we're seeing are very, very unfortunate. So before the woman comes to the hospital, there's what you call a breast self-examination. So 40% of diagnosed breast cancers are detected by the woman herself. Like I mentioned, a woman can be taking a shower and then feel her breast and then she sees a lump. So women, adult women of all ages need to check their breast, okay? I think there's a segment on breast self-examination that's coming. So maybe Muna would go into those details. I'll just briefly mention it. It has to be done by women of all ages, preferably from 18 and above. They need to check their breast. How often? Once a month, 5 to 7 days after the start of their menstrual cycle, okay? So what they're looking for, there's a principle of look and feel. So they'll look, maybe if they're in the shower, they can look in front of the mirror and look for the changes. Can anybody remember the changes we saw? Dimpling, that's a retraction of the skin, retraction of the nipple, discharge, discolorations that you would have. So you would look at both breasts and do a comparison. Obviously, both breasts are not the same. One breast tends to be a little bit larger than the other, but it's not a significant difference. But if you notice that one breast is big and then the other one is smaller by 5 centimeters, then you know that something is wrong somewhere, okay? And then that's the looking part. And then the feeling part, you use 3 fingers, okay? The 3 fingers, the index, the middle, and the ring finger. And then the woman, either in the shower or lying down, tends to feel the different quadrants of the breast. There are 4 quadrants. Okay? So you have the outer upper quadrant, the inner upper quadrant, the lower inner quadrant, and the outer lower quadrant. Okay? So she feels for all these quadrants looking for a lump. And then when she's done, she lies down and then puts the left hand on the right armpit to see whether there are any lumps. Okay, so a woman can be taught how to do this, even if she doesn't have lumps, but she should be encouraged to do it every month. Because if she's used to it and then something abnormal happens, she'll be able to detect it very early. Okay, so breast self-examination is something that can be taught to all women during sensitization and awareness creations so that they'll be able to detect the lump. What percentage did we say of breast cancer is diagnosed by patients? That was the first slide that I showed. 40%. So that's almost half of lumps can actually be detected by the women if they do breast self-examinations. Okay, so this is an explanation. I'll leave Muna to do that. So when the woman detects it, it comes to you. Maybe you are the nurse stationed in maybe Bansang or maybe another remote village. And then the woman comes to you and says that I have a lump. What do you do? So you do what's called a clinical breast examination. So basically the same thing that the woman did, but as a clinician, meaning somebody who's a healthcare worker, there's things that you'll be able to pick up that the woman cannot pick up. And then you'll be able to guide that individual to do further investigations. So you want to check for a lump, check for any physical changes, the ones that we described. And also, the goal of this is early detection. Why not prevention? Why is our goal not prevention? Why is our goal early detection? Do you understand the question? So the question is, with the clinical breast examination, a woman comes to you and then you examine the breast in the clinic or in the hospital setting. And I said that you need to look for lumps and any physical changes, with our goal being early detection. I'm saying, why is our goal early detection and not prevention? Because when you talk about disease, you talk about prevention. Yes. Exactly. So that's the great answer. So breast cancer, like most cancers, we don't know what causes it. Risk factors, like I said, it doesn't mean you're going to get it. It's not a cause. It just increases your risk of getting the cancer. So you can only prevent something if you know what the cause is. Like an infection, you can prevent an infection. We take vaccines, for example. When somebody's born, you go and vaccinate because you know what causes it, and then you're giving a vaccine for it. But when it comes to cancer, we don't know what's causing it. We know what increases your risk, but we don't know what's causing it. So the goal is to detect it when it appears early. So there's nothing like prevention of breast cancer. You don't talk about prevention. You talk about early detection. Okay? So that's the goal when it comes to clinical breast examinations. You detect it early so they can treat it early. How do you confirm? They come to you, you see a lump, you're the nurse, and then you say, yes, there is a lump. How would you confirm whether this lump is cancerous or not? We said 80% of lumps are not cancerous. So how do you confirm? How do you know for sure that this lump is cancer or this lump is not? Anybody have any ideas of any test? A biopsy. What's a biopsy? What's a biopsy? No, but you're repeating the same word, biopsy. I'm asking you what biopsy is. Okay. A sample of, so it's a tissue sample, right? Okay. So there are 2 parts to breast cancer. When you do your examination, there are 2 investigations, main investigations you do. So when they come to the hospital, you do an imaging. So the most common imaging that we use is called a mammograph or mammogram. A mammogram is just like an X-ray. It's an X-ray of the breast. Okay. So normally you do it for women who are above 40 years of age. So you take an X-ray of the breast. If there's a lump, you'll be able to see that lump. Okay. You can also do an ultrasound. This is something that we do. I mentioned that we don't have any mammograms, although hopefully here in Banjul, maybe in the coming days, if not weeks, we hopefully would be having a mammogram that's functional. So we would hopefully be doing mammograms. But currently what we're doing is ultrasounds. So the ultrasound goes in, checks to see this lump, and then it tells us, yes, there's a lump. And it gives us an idea. Does this lump look suspicious? Or is it a benign lump, meaning it's a fibroadenoma? That's what most young women would have. Okay? But ultrasound will be able to give you an idea about this lump and how it is, whether it's cancerous or not. Okay? And you can do an MRI for maybe younger women who have a family history of breast cancer, and you want to make sure you don't miss anything. So the other one is the biopsy, like you said. So there are different types of biopsy. There's a surgical excisional biopsy. You can take a needle biopsy. So what the biopsy does is just takes a tissue sample out of the lump, and then it tells you is this cancer or not. So it's the most reliable way of saying that somebody has breast cancer. Okay? So the diagnosis, you would have to do an examination, ultrasound, mammogram, and then biopsy. So these are the stages when you're thinking about breast cancer. So what does one do if you confirm it's breast cancer? You have to stage it. Meaning, is the cancer only in the breast or has it gone to other places? The most common places it can go to is the brain, the bone, the lungs, and the liver. Okay, so breast cancer can easily spread, especially if they come at a late stage. Okay, so treatment of breast cancer, how do you treat breast cancer? We give. Has anybody seen a breast cancer patient? I imagine some of you are in your final year. You have never seen breast cancer patients during your rotations? You've seen one? Okay. A family member who passed away, unfortunately. Okay. Tita? You've seen one. And what did that patient get as in form of treatment? What treatment did they get? She was bleeding. So both of you mentioned cases where they were advanced. One unfortunately passed, the other one was bleeding. So these are very, very advanced cases. So we want to be able to catch breast cancer at an early stage. And I re-echo and emphasize the fact that awareness is very important. If people are aware, they will come on time. So again, early stage, advanced stage, it depends on what stage the patient comes in. Early stage, you might spend $5. Advanced stage, you spend $150 and you still wouldn't get cured. So even for us, as a health system, as a country, it's in our interest to diagnose breast cancer at an early stage. So a lot of people have to come in to be able to treat breast cancer. It's not just one person. So when I treat breast cancer, it's not just me. I have a whole team. Okay, so you have the surgeon, you have the pathologist who would look at your biopsies, you have the radiologist who would do the ultrasound, you have a medical oncologist who would give certain types of medications, you have the radiotherapist who would give radiotherapy. So it's a whole team. It's not just one individual. So there are 5 options: surgery, radiation, hormone, chemo. I'll just briefly mention 1 or 2. Surgery, you have breast cancer. What do? You remove the cancer. This is a very emotional period for a woman because a woman's identity is actually related to her breast. So if you tell a woman that I'm going to remove your breast or part of your breast, it's not something that she would take lightly. Okay, but with cancer, you need to remove it. If you don't, it will spread. So you can either remove just the part of the cancer or you remove the whole breast. We tend to do this more often because they come late. If they come early, we can conserve the breast. Okay, chemotherapy, very powerful drugs that you give through IV that helps to kill the cancer cells around the body. Hormone therapy, again, it's a hormone-dependent cancer. So we give a hormone therapy. The most common we give is tamoxifen. I'm not sure whether you've heard that name. So it actually blocks the hormones from acting on the cancer cells. So the cancer cells tend not to grow. They die down. Okay. Radiotherapy is radiation. Is like a powerful X-ray that you put on the cancer cells and then it kills the cancer cells for you. Okay. So in essence, the discussion we would be having is about risk reduction. How do you reduce your risks? Having a balanced diet, eating well, having a healthy weight, avoid being overweight, an active lifestyle, which would prevent not just breast cancer, but all types of cancer, not smoking, reduce or avoid alcohol altogether, and for the women, breastfeed. It's important, not just for the child, but for your own health as well. Okay. Breast cancer has no gender. Men can also get breast cancer. Okay. So breast cancer is not a death sentence. Somebody who has cancer doesn't mean that they're going to die. Somebody who has early breast cancer is diagnosed and treated on time. You realize that maybe out of 100 patients, 95 would still be alive at 5 years. Out of 100 patients, you have 90 who would still be alive at 10 years if they are diagnosed and treated on time. So breast cancer is not a death sentence. The message here is early detection can save lives. You work on modifiable risk factors we saw, and then screening. Teach women how to examine themselves. Once they know how to examine themselves, they would come early, and then we'll be able to treat them on time. So I thank you for your attention.
Really educated us. And do we have any questions that we would like to ask Dr. Jaiteh before he takes his leave? Anyone with a question? Okay. Do you want to come over?
Okay. A lady who have breast cancer, can the person, if the person have a child, can she breastfeed the child? Or that's
Myths about breast cancer. If somebody has a child with breast cancer, can they breastfeed that child? So I think I would take you back to the risk factors. Like I said, breast cancer we don't know what causes it, but you have risk factors. And amongst the risk factors, breastfeeding is not a risk factor, both for the mother and for the child. It actually protects the mother. So breastfeeding doesn't mean that the cancer cells are going to go from the milk into the child. And even if by some miracle it happens, it still will not cause breast cancer, because the mechanism for breast cancer is still not fully understood, but it's not a transmittable disease. Somebody with breast cancer, maybe a wife who has it, the husband shouldn't shy away or ask for a divorce because she has breast cancer. No. So it's not a transmittable disease, and it's not something that can be transmitted through the breast milk. But there is a chance, for example, wherein, like I mentioned, family history. So if it's a female child, that child may get breast cancer when they grow older. But it's not through the breastfeeding that she'll get it, if she is to get it.
Is it possible to conduct a mass spectrometry?
I didn't understand that.
If the cancer happens to spread to the body, not the breast alone, like if it's a breast cancer and it happens to spread out to the body, is it still advisable or is it still necessary to do the mass spectrometry?
Your treatment. Normally, if the cancer spreads to other parts of the body, if you remove the breast, are you treating the cancer? Do you think the patient will be cured? If the cancer goes maybe to the liver and the brain, and then they have cancer in the breast, if you remove the breast, do you think you solve the problem? Yes. So it has already spread. So rather than taking the woman through that stress of emotional stress, physical stress, the risk with surgery, you need to have a discussion with her and make her understand that removing the breast would not resolve the issue. So you can put on some medications like chemotherapy to try and reduce the size of the lump, or maybe radiotherapy. But removing the breast would not solve the issue. There are times when we do surgery for patients with metastasis, meaning the cancer has spread, but we still do surgery. And that is maybe the example that Tita gave, wherein you had somebody who came in with breast cancer but it's bleeding. If you don't remove the breast, they're going to continue bleeding. So you do surgery not for the cancer, but for the symptoms of the cancer. Or somebody with a very big, infected, massive breast cancer, you would also want to do surgery to alleviate them, but it does not solve the problem.
If this breast cancer can kill the CD4 cells, like white blood cells, and that will make the body to welcome other diseases aside from this.
Immunosuppressed. In a way, yes. Cancer is an immunosuppression, but not in the same way HIV is. Because even in HIV, you have CD4 counts that have to be at a certain level before you can be exposed to opportunistic diseases. In cancer, you do have a slight depression in your immunity, but it's not enough to say that you would be exposed to other infections in the same way as HIV. For example, in the COVID pandemic, cancer patients are called at-risk patients because of the slightly suppressed immunity, but it's not the same level as HIV. So you wouldn't expect a cancer patient to be exposed to maybe fungal infections more than a normal individual would. It's not to that level. It's not the same. The social media, but we are actually organizing it in collaboration with the doctors and the nurses. And I'm sure maybe Muna might have spoken about it, wherein we hope that we'll be able to have the members of this honorable association come in. Okay, I'm told that you're invited. We hope to see you in big numbers to come and support this effort. So we're going to have a free screening. You can talk to your mothers, your sisters, your neighbors, your family members to come for this free screening activity that's going to be tomorrow from 8 to 5 and on Sunday as well from 8 to 5. You're going to have a free screening. So you're going to have a clinical breast examination. You're going to have a free ultrasound and a free biopsy that's done in order to detect, to see whether there's any cancer in any of the participants. So I would encourage all of you to come and support this effort. And also, I think in the long run, like I mentioned, I think nurses are very important when it comes to the fight against cancer. And in healthcare as a whole, I think your numbers are your strength. And I think if doctors and nurses are able to work together, we can have a big impact. So October is considered Breast Cancer Month, but we realized that we need to double our efforts. We cannot wait for every October. So we need to have outreach programs, and hopefully we'll be reaching out to the nursing community so that we can see how best we can collaborate and reach out to the very far off villages in order to create awareness and sensitization, and maybe carry out screening programs as well for those who cannot come to the Combos and Banjul. So again, thank you very much, Muna, for inviting me. And I hope that today's lecture has been instrumental in helping you understand what breast cancer is and you spread the awareness out to your communities. Thank you.
So as nurses, I believe the lectures that Dr. Jaiteh gave us today will enrich us to create more awareness. So we're indeed honored to have Dr. Jaiteh here doing this presentation, this wonderful presentation, and I believe it will create an impact to us all, and then we will spread the message. We will also help in our society to be aware about breast cancer. Thank you very much, Dr. Jaiteh. We're grateful. Next on the agenda, we would like to have Dr. Babukar Cham, the present president of NAGAM, who is also a leading lecturer of the school, Nursing and Midwifery Council, to come and give us a word of wisdom, and also he will lay emphasis on the need to create more awareness for breast cancer. Thank you.
This is a very important gathering, and it is important in the sense that we all know that breast cancer, I am biased because I did my PhD thesis on cervical cancer, and everything is about cervical cancer. So if I mistakenly say cervical cancer, know that I am biased. But they are equally important. Both cervical and breast cancer are one of the leading, or they are the leading causes of female cancers in the country. And as Dr. Jaiteh said, creating awareness is very, very important. Creating awareness is very important. In this hall, in this gathering, it is not only the nurses. Nurses are here, but public health students are here, as well as students from the School of Education and students from the School of Agriculture. So now, it is important that nurses create awareness on cervical cancer, breast cancer. But it is equally important that public health officers, whose primary mandate is health promotion, environmental health, and public health, to create awareness on breast cancer, as well as cervical cancer. We go to the teachers. You teach our kids, you teach our children. At your level, if you teach our young ones to know about breast cancer, they will transmit or they will translate that information to their parents, and then they will be educated. It is very effective in educating the young ones, so that tomorrow they will also be role models. They will be able to detect it early, as well as not only detect or preventing changing or working on the modifiable factors, but also they will educate their parents. At the end of the day, if you educate 10 kids, they will educate 10 families. So obviously, teachers have an important role in creating awareness. We go to the agriculturists. Doctor said balanced diet. Without you, how will we eat balanced diet? Women do a lot of gardening. At the end of the day, the best produce is sold to the market. They are not eating it. And they come back to our facilities being sick. So for us to stay healthy, you, the agriculturalists, have to encourage us not to only grow, but grow and eat what we grow. So you have a very important role to play. Everybody in this gathering has a role to play. The team is talking about together we can change. That is, the C is the change the conversation. We have to change the conversation. It should not be limited to nurses alone, but everybody has a role to play. Assist those impacted by breast cancer to get informed information they deserve, and nurture and build a community of support. When somebody is diagnosed with breast cancer or cervical cancer, we need support, especially at the late stages. We need that C needs that psychological support. C needs that emotional support. C needs that nutritional support. C needs that individual support or financial support. So therefore, we should be there for them. We should be educating them. The support we give them can impact positively in the survival rate of those women. So therefore, it is not only limited to awareness creation, as well as supporting them, dispelling stigma and discrimination in our societies. So I implore everybody to take an active role. This is in line with the vision of the National Association of Gambia Nurses and Midwives. We are working on our strategic plan, and among our strategic plan is community outreach and education and sensitization. So it is already captured in our 4-year strategic plan. We have started going international by collaborating with national associations in our neighboring countries. Just a day before yesterday, I started communicating with the president of National Nurses Association in Senegal. And then we are trying, if we establish the collaboration, at the end of the day, such occasions can be commemorated in a border village, whereby we can create awareness both in Senegal and the Gambia, as the Ministry of Health is doing. So therefore, I'm urging everybody to take an active role. I think Muna will do the BSc examination, that is the breast self-examination or the demonstration. It is said that about 16% of all female breast cancer accounts for about 16% of all breast cancers, and 22% of most common cancers in women. So obviously it is a problem, and it is a national problem. As doctor said, so many people are down there, they have a lump, they have something, a problem, they are not coming until it is very, very late that they are coming. So if we do sensitization, create awareness, then we will be seeing more cancer patients, and then we will be detecting them at an early stage, whereby it is easier to treat, and then it is easier to handle, and then we will prevent mortality. So thank you very much.
The early signs of breast cancer and what to do when we feel abnormalities in our breast. So we would like to call the drama team to just come and give a short play. We would like to call the drama team to now come and give a short play that teaches us about breast cancer and then the early signs and what we need to do when we feel abnormalities in our breast. So can we have the drama team to come in?
I'm Madam Drame, as you mentioned, and I have a poem for you. And it reads, my gender can't bring me down. My worth is beyond this. My smile gives hope to the world, and my hug brings about pulsation. This breast of mine builds a family, a society, and a nation at large. It's no crime for me being a woman. I have lived a happy life before this devil drank in my jar of health. Cancer. It seized my peaceful night, caged my social life, deprived me from my mental health, and slaved me in his devilish kingdom. Cancer. But hey, thanks to self-breast examination for early detection will protect my little Zara. Thousands of young women out there are yearning for their health to seek freedom from this devil. Terrified to face mastectomy, radiotherapy, chemotherapy, because these had drastically compromised with my immune system. Cancer. My little Zara crying all the night, looking for something to suckle, only to find out that mama has a flat chest. I cry loud in my disappointment. For every single noise from my little Zara, take me to the seventh heaven and bring me back to earth. The cry of my little Zara makes me so sad that it takes me to the seventh hell and bring me back to earth. My dear Zara, today I will teach you about breast cancer. For self-breast examination will lead you to early detection, and early detection will protect you from what mama is going through right now. I am sorry that I didn't seek help at the right time. I'm sorry that I didn't seek treatment earlier. I'm sorry that I'm going to leave you behind this early. I am sorry that you are too young to feel the absence of your mother. Stay happy till we meet in Firdaus, my dear Zara. Thank you.
And this is a play presented by the November 2020 class on breast cancer. And the play goes, it's a play about a happily married woman named Kadi, who is married to her husband.
Wife, who does take care of me both inside and outside of my house. Oh, God, I'm blessed. Where is my sweet Talata? My myocardium. Not just to go and I see the way. If I see you, my heart is content.
Ah, really?
Yeah, about yesterday night, I should be happy now.
It was a special one.
Oh, yes, oh, yes.
Whenever I see you smiling,
You sound what I'm saying?
it makes me feel good.
Yeah, man. So where is the breakfast?
It's already set and on the dining, waiting for you.
Without this thing that I know it's always delicious as usual.
Just as usual.
Let's go.
Okay. Let's have breakfast.
Okay, this has been the routine of this noble or happy family. Until one day, when Kadi started to feel some sensations in her breast, she decided to see.
But I'm having some sensations in my breast. And whenever I touch my breast, I feel like there is a lump in it. I am also having some discharges. I am really scared. But the most important thing, I think I should visit the hospital. I need to see a doctor. I need to see a doctor and seek for early treatment.
Afternoon. I'm fine, thank you. Please have a seat.
My dear, this day I'm not feeling fine.
You're not feeling fine. What's wrong?
Since yesterday, I was taking bath, and then I realized that my breast is having some lumps. When I feel it, and then I observed that it's also having some discharges, and then it is so tender. So I said, let me go to the hospital and seek for treatment.
All right, you did the good thing. Your
Yes.
name, please?
My name is Kadidran.
Cathedral.
Yes.
How old are you?
I am 24.
24. And where are you from?
Parato.
Okay. So the complaints you just stated, how long have you been seeing this?
For the past few days.
Past few days.
Yes.
Like how many days? Is it up to a week?
Yeah, it's up to a week, yes.
So what are the complaints? The main complaints are
Feeling that there is lump in my breast, having some discharges from the nipple, and also feeling that the breast is so tender.
extended.
Yes.
So I'm going to collect your vitals, then I will examine your question.
Okay.
So I have collected your vitals already, and they are all within the normal range. So, do you have any family history of breast cancer in your family?
Yes, I have an auntie who died of breast cancer last year.
Okay. That's what you worry about.
Yes, that makes me worried to come.
So I'm going to call the doctor to come and review you. Then you'll be able to know what is exactly wrong with your breast.
Okay.
Hello, doctor. How are you? Please, we have a patient here. Let me give attention. Can you kindly come?
Hello, good afternoon.
Good afternoon, doctor.
How are you?
Fine, thank you.
You called me?
Yeah.
For
This
me?
is the patient.
Okay, okay,
She have complaints.
okay,
Like she's having a lump in her breast.
okay,
The vitals are normal.
okay,
So I review her. There's some family history of breast cancer.
okay.
Like
Kadi, how
one
are
of
you?
her aunties.
I'm okay.
How is today?
Alhamdulillah, it's okay.
So, your vitals are kind of normal,
Yes.
but then your complaints are like you have lumps in your breast, right?
Yes.
Yeah, so, all right. Yeah, the examination is right.
Yes.
And then, based on it, I'm suspecting something, but then before I will just give my final conclusion, I think I will send you for some tests. Yeah, you have to do some tests like breast X-ray, that is monogram, and then you have to also do breast ultrasound. But then
Okay.
before you go for all those, I will take some samples from your breast, that is the biopsy.
Mhm.
I have to do the biopsy first. So now you can prepare her for the biopsy and explain what is the process for the biopsy. Yeah? Then after then, I will let me go inside and write these two tests for her, so that you can go and do them at one of the clinics. Yeah. All right. So Kadi,
Yes.
see, we take care of you. Let me just go in and come back. Huh?
All right, thank you.
All right.
Yeah, thank you. Daddy, as you
Yes.
seen, these are the tests that we need to do.
Yes.
A biopsy, as the name indicates, is not something that is big.
Yes.
Just for us to collect the sample so that we will be able to detect what is actually wrong with you.
Yes.
It might not be sensitive, so don't be afraid. If it is sensitive, we will detect it early and we'll be able to have it.
Okay.
So be reassured that we will make our level best to
Mm-hmm.
keep you safe.
All right.
Thank you.
Okay.
So you have to do the test then after you come back and give us the results.
Okay, thank you.
And the tests were done. Kadi was confirmed of having stage 2 breast cancer. But later, when she came back home, the husband no longer find her. Let's see what happened.
Wow, look at this beautiful. Wow, look at the boobs.
Good afternoon, my love. Good afternoon, sweetheart.
Why are you sweethearting me?
What's wrong now?
Look at your unbalanced breast.
Hey, sweetheart, but why are you talking like
Why
this?
did you even go for the surgery?
But that was the best thing for me.
It is the best thing for you, but it is not the best thing for me. I need it.
You don't have to talk like that.
You have one. Look at this young, beautiful girl. They have two. Can you compare 2 and 1?
So you have
Shut up. Where did you even go for this surgery? Look at what chemotherapy did to you. It made you dark. Look at your hair. You lost your hair.
I'm sorry, but this was the best thing for me to do and treat it early. I could have lost my life. God, I could have lost my life. But look how what it results to me.
Steven, yes, so how are you doing? I'm good.
I miss you.
Yes, I miss you.
How you doing? How was yesterday?
Yesterday program was boom.
That clubbing, eh?
Hey.
Oh my God.
Yesterday, if you see those people there,
it was so nice.
I love the thing.
Do you heard what is happening in town?
What is happening now?
That woman.
Which
she
woman?
did breast cancer surgery. Her breast is deformed.
That lousy lady.
Now she puts pieces of cloth inside the bra. She did chemo. You see, her skin is dark like charcoal.
Tell me
her
more.
hairs are all
My sister. I love this. Tell me.
Her husband is just complaining and you don't know what is happening in the
That
family.
man
house.
is so grateful now. That man don't love the woman.
But breast is what they find for now.
My sister, let's go. Let me go and visit.
Oh God. See what the results of surgery has done to me. I no longer have respect in my house, not even in the society. My husband no longer likes me.
Dija, but
Yes.
this is not the Dija I know. This is not my best friend.
I am still the same person.
Dija, I know this is rather unfortunate. But my friend, what I want to tell you that I am here for you. We will go through this together. Dija, I know you of someone who is very strong. You are not the only person who has gone through this. A lot of others has gone through this. But today, they are who they always wanted to be. They have achieved their goals.
It's
My
not
friend,
easy.
You need to stand strong for yourself. I don't know you are giving up. We will fight this together.
Sure, we will.
So please, I want my best friend back. I want that lady who is always strong, who always fights her challenges.
Thank you. Thank you. I will do as you say.
Thank you.
Courage wears the face of your ability to love and be loved. Breakthrough happens when you discover yourself what had nothing to do with what you look like. One important and unimportant thing that happens to a woman with breast cancer is that we are forced to cope with only not with the life threats and many physical and emotional issues, but also with a major crisis with our femininity, body image, and self-esteem. But hey, cancer, it may seem like you may have controlled my life, but you really don't. Your presence only makes me stronger, braver, and wiser. The fear of your name no longer haunts the fear of your name no longer haunts my soul because I know my soul belongs to me and to God. My soul will run, leap, and tower over your attempts to put me down into despair. Those who surround me will fight for me to let it be known that we will not surrender. Our hearts and souls are tied together in a lasting bond that no amount of your can break. You see, cancer, you do not own me. I own myself, and we will survive together.
By the president, Madam Muna Salami. So we'd like you to take us through the breast self-examination.
My name is Dr.Jaiteh, and I'm in charge of operations for the free Efsth breast cancer screening we are doing. Since we are part of the society, we are eating what they're eating, we are breathing what they are breathing. The only thing that makes us more special is that we come here, assemble, and learn about this. So this, I'm hoping, would not just end here. It would serve as a medium and enhance our understanding on how to approach patients with breast cancer, because breast cancer actually affects every part of a woman's life, her emotions, her looks, everything that makes her a woman is attacked. Sometimes they go through chemotherapy and they cannot give birth again. So I hope this serves as a means of enlightenment for all of us, so that when we face these patients, when they come to us, we're able to treat them better. We are able to treat them like we are facing our own sisters, sometimes brothers too. So I'm really happy to be here. And Muna, this is great. If we could have more of this, not just for breast cancer, but also for other cancers and other health conditions that affect us. Thank you so much. And you all are invited to the screening, to be screened, and also to help us screen members of the societies. Thank you.
Time we'll just go through self-breast examination. In as much as we In as much as we want to fight cancer, we need to know, in order for us to do this, we need to know how to do self-breast examination. Like Dr. Jaiteh's presentation made mention that 40% of women that happen to be fighting cancer, 40% are those that do self-breast examination for themselves. So it's actually important as healthcare providers, as nurses, or any other person out there to know how to do self-breast examination to make sure that we detect breast cancer early and then seek for treatment as early as possible. So first of all, for ladies, there is this particular month, the particular time of your cycle that is targeted for one to do self-breast examination. So this is immediate, that is for those on the reproductive age before your menopause. You have to target the first week, 1 week after your menses, because at this point in time, the estrogen and progesterone level in your system has reduced. So at this point, you can have an accurate result of what you're actually trying to detect within your breast. So 1 week after your menses is advisable to do it. Probably 6 days or 7 days after your menses, when you go to the bathroom. You know, when we're taking shower, we have soap on our body. It makes it so smooth that you can do self-breast examination without having much difficulties. So what we do here is, if possible, you can get a mirror before you look. We observe first, is there any deformity within the breast? Are there any visible mass on the breast? Is there any discharge that you're able to see as you stand in front of the mirror? Is there any different shape, the different shape of the breast? Is there any nipple inversion, that is having the nipple of the breast going inward? Is there anything of that that you can see through the mirror? Being done with that, then you can just hold your waist. If you hold your waist with one hand, then you can use these 3 fingers. That is the big finger, the middle, and the ring finger. These 3 can be used. The tip of your fingers can be used. Like Dr. Jaiteh made mention earlier. You start with your left left outer upper quadrant. You start going inward. Go in a circular motion to feel if there are any lumps while your hand is on your waist. Are we together? While standing, make sure your hand is on your waist. Then you use the other hand to palpate if there is any lump. This is when you're taking shower and 1 week after your menses. So if you're done with that, going round circle in a circular motion, then you can do the same thing for the other breast. After doing that, then you can also go beneath your armpit, under your armpit, to see if there are any lymph nodes, swollen lymph nodes, because all of these are signs and symptoms that are shown during early stage of breast cancer. You can get to know about this when you're palpating. So check for the lymph nodes. Are there any swollen lymph nodes under your armpit? Then if there is none, you keep on doing this for every end of your menses. After 1 week of your menses, we keep on doing this. So for those that have reached menopause, what you can do best is to select a particular date in the month. Like, let's say you happen to choose 1st of January, like for the first day of the month, the 2nd and the 3rd. But make sure it's something that you're consistent with. You do it this month, maybe on the 15th. Then next month, by the 15th or 16th, you should be doing it for yourself again. Are we together? Because we believe that when you get to menopause, the level of estrogen and progesterone will be reduced. So this time you can choose any date within the month that you're going to be consistently doing this during the month. So away from that, you can also do it lying down. That is lying on your back, making sure that you have one of your hands under your occiput. No, let me not use, we are not nurses here or nursing students. So you put your hand at the back of your head here, lie flat. Use, like I said, before you even lie down, you need to inspect, observe that if there is any lump, there is any nipple discharge, or anything that we've said the signs and symptoms of breast cancer are, you look for those ones. After doing that, then you lie on your back. Make sure you use these 3 fingers again. Go around in a circular motion. Try to feel for any lump. Look for any lymph nodes underneath your armpit to make sure that if there is any, then you have to report to the health facility as soon as possible. Because if we detect early and report to the health facilities, there's something that can be done for you. The survival rate or the survival rate can be high if you're detected early. There was this patient that some time ago that came to Efsth. She was a family member. But she does that self-breast examination. When she told me, I escorted her myself to the hospital. Biopsy was done, a lot of tests were done, and they detected that it was a cancerous breast lump. So at the end of the day, she was able to get treatment as early as possible. And from her surgery and chemotherapy, everything being done to now, it's over 2 years now. She's happily living. When you look at her outside, you don't see her as a survivor of breast cancer or a victim of breast cancer. But she's living happily with like any other person in our society. So this is what early detection can bring you. Whatever sickness it is, trying to detect early and seek for medical help will actually increase your survival rate. So this is the message I have for all of us to take note of. Let us not be lazy in doing self-breast examination, and as well teach those that we left at home. Because the more you are trying to educate a lot of people, the lesser risks of, risks of getting to the advanced stage of cancer we will be. When it gets to the advanced stage, there is little that can be done by the doctors or the healthcare providers to save you. All they can do is management until God decides what to do. So this is what we have for you with regards to self-breast examination, and I believe we will spread the message within the families, the society, and the nation at large. Then we'll have a very healthy society to live in. Thank you.
Thank you very much, Madam President. I would like to also call, this is a surprise, I would like to call Mr. Mendy on stage to give 1 or 2 words concerning breast cancer awareness. Thank you.
Yes, where is the camera? Is the cameraman getting me? You are the one to get me, I'm not the one to get you now. Anyway, I am Mr. Albert Mendy. I'm a lecturer here to the School of Nursing, Gambia College School of Nursing. And it's a very good initiative, and I'm impressed. Though I was late to join you people due to 1 or 2 other reasons that couldn't give me the chance to join you earlier on. But I believe you have done something very, very reasonable here. Based on even from the drama that I met here, have taught me so many things that I would have gathered and share with others in the society. Because it's not about all of us who gathered here alone, but it's about the society, because we converge here in order to carry the message to the public. That's the Gambian people and the entire world as large. And I believe all of you have said almost everything. There's nothing that I will say that will be of difference to based on the previous speakers, what they have said with regards to breast cancer. And breast cancer is something that traumatized a lot of families today. It has affected a lot of emotions somewhere. That is marital emotions, engagement emotions, loving emotions. I can count them. There are many. There are some who will encounter this problem and their partner will tend to leave them. There are some who are married, but as a result of this problem, their partners tend to dump them because they are sick. We could also read it from the drama that was presented here, wherein the man said, the breast is imbalanced. There's one breast up and the other one was down. Anyway, and the man couldn't build that much interest on the woman again. So it's something that we have to carry to our families. We have to carry it. Like I always, whenever I'm lecturing, I always tell this to my students. Whatever information we are giving you, we are not giving it to you alone. We are giving it to you to pass to others as well. And that's what makes it nursing. If you read and understand the definition of nursing, doesn't actually entails you personally, but nursing is far beyond that. Nursing it, I get the message, pass it to somebody, and then from that person to another. And then at the end of the day, all of us will become aware. And like I say, breast cancer is a concern in the entire world, and Gambia is not an exemption. Then we need to also carry out the message to our brothers and sisters as well. Though you people are so particular about women, But us men too, we have breasts. Oh. Think we don't have breasts? And if you look at latest research, some men are affected. I hope whether you people are aware of it. Men are affected currently. So it's not only about women. Even our close brothers, we have to also educate them to examining their breasts, like we are teaching the women to do so. So let them be aware of the impact and the negative aspect of their breast disorders. So it's something that really impressed me, seeing the students organizing this very important meeting on a particular topic that is so sensitive in our nation, sensitive in our society, and sensitive in our institutions. And it's something that gathers almost, I can say, all the students from various schools at the Gambia College, and even university students as well. And others came here and presented as well. So I'm also saying thank you to all of you, leave all the way from Brikama to come and join us here at the School of Nursing. So you are welcome, and we thank you so much also for contributing and joining your fellow students to bring about awareness to the Gambian populace about breast cancer. And college is one of the oldest institutions in the country, and it's the institution that brings about credibility when it comes to academia. People might not know, and sometimes some of our colleagues will question us, why do you come to RN school and you don't go to UTG with this result? And usually you can laugh, but what RN can give you, UTG might not give you that. Do you know that? What school of education can give you, UTG might not give you that. What school of public health or agriculture can give you, UTG might not give you that. Don't feel discouraged. All of us pass through the same trend. And today we are here to mentor the young ones. We are young and strong, and we gather that knowledge to guide them. We gather that knowledge to put them through. Academia is never useless, despite or irrespective of whatever institution you pass through. And you have to put that in the back of your mind. Coming through the RN doesn't actually mean that you are the weakest student. Do you know that some of us here have qualification, we can go and study medicine? Or even have more qualification than those studying medicine. Our qualification at the School of Education can take us to university and study there like other students who are studying, likewise agriculture or public health. So actually, if we come here, we have to strengthen that. And college is one of the strongest institutions in the entire country. And that's what I always tell people. We go through there. Myself, I'll give you an example. I passed through School of Education, but I'm a runaway teacher. Anyway, I didn't complete. I started there some years ago, more than 10 years ago, when I started a little bit. Then after, I don't like teaching. But you see, God trapped me and bring me back again to come and mentor the young ones like myself. And I'm impressed also to join them here in the RN school and share the little knowledge that I have with you. So thank you so much. You have been sitting for quite a long time. And I say, let me conclude here. I'm a teacher. I can talk here till tomorrow. So thank you so much for coming here, and thanks so much.
Not to waste much time, we would like to call the president of GCSU to come and give the closing remarks. Madam President.
Good afternoon, beautiful ladies. It seems like we're seeing only ladies here now. Oh, it's Friday. Yeah. Yeah. Thank you very much, the president of Sanamza, our able boss, mentor, a lecturer of the Gambia College. We have the vice president of SASA, School of Agriculture. We have education minister of School of Education, vice president, School of Agriculture. We have public health students here. And then the executive members of Sanamza, Galak, Hadi Galak, and all other protocol respectfully observed. The CHN students, University of the Gambia, medical students, and the nurses, we welcome you all to Gambia College. I will begin with what our able lecturer said. Gambia College is the oldest and the tertiary institution, the oldest tertiary institution in the Gambia, and the biggest tertiary institution in the Gambia. In fact, we are the backbone of this country. If you look at the Gambia, they said agriculture is the backbone of this nation, and we produce the agriculturists. The teachers are from the Gambia College. The nurses are from the Gambia College. The public health officers are from the Gambia College. So there is no institution in this country that I personally or we can be proud of better than Gambia College. You look at the vice president, from the vice president of the Republic of the Gambia, coming down to the parliament, you go to other ministries, all the permanent secretaries that serve as technocrats in all ministries, 98% of them are students, former students of the Gambia College. So we need to be proud of ourselves. We need to be proud of this institution because this institution make the Gambia called the Gambia. That's why the name of this institution is in fact the Gambia College. So we need to be proud of it. And I am super proud of the Sonamza Executive and the Health Ministry of Gambia College Students Union for organizing this event. This is a national call. And it is something that each and every citizen of this country needs to stand to make sure that breast cancer awareness is put into place, or people need to come out, and we people that don't have the knowledge in breast cancer to also have that opportunity. Because if you look at the Gambia, they said a problem for one or two is a problem for the entire nation. So having these young, vibrant people coming out and then organizing such, and then they are not only limiting themselves within the premises of the Gambia College, but they are going out to schools. Students that one day or the other will reach at that stage, or in fact they are at that stage, also to talk to them about the dangers of breast cancer and how can they prevent themselves from it. It is something that is great. And I always said, Gambia College, it's now time for us to take, it's now time for us as Gambia College, we call ourselves, we should not sit in the college and said we are the oldest, the biggest tertiary institutions, but then what are we doing to the society? What are we giving back to the society is something that is very, very important. And these are one of the things that are very important. And we are saying that it's very difficult for Gambia College students organizing events and having partners outside. Like the international NGOs or having government to come and then support the institution. In fact, Gambia College as an institution, we feel that we are neglected by the society. But even though when we are neglected by the society or we don't have sponsors, but we can do a little better. We can do something better. That is, this one is part of it. Let's come out and give our best to the society because we make the society as an institution. We make the society. If you look at most of these institutions in this country, most of them depend in the Gambia College. The University of the Gambia, most of their lecturers are from the Gambia College. You go to School of Education in the University of the Gambia, their lecturers are lecturers of the full-time lecturers of the Gambia College School of Education. You go to agriculture, you go to nursing and other places. So if the university and other institutions are doing the same thing, why not us? That in fact we are the parent of those institutions. Let's double up our effort. Let's give back to the society. And those that are fortunate to be here today, let us not stop it here, but let's go out to the society. Let's go back to our homes, our communities, whatever thing that we learn, all this educate, because most, like people like me, I am not a health student. I am from School of Education, but what I learned here today is something that I never learned before. We all go back from School of Agriculture, School of Education, Public Health. You go back. Let's go back to our school and we give back whatever thing that we learn here. It will also help us better. And for Sonamza, let's always partner with other sub-associations, issues like this, like agriculture and education. For public health, they are into health, they are health students, but agriculture and public health, agriculture and education, you partner with them to have such of these events. In fact, let it not only be here, but then also we go where the large number is, that is Brikama campus, and as far as Basse campus. The GCSU, that is the Gambia College Students Union office, is always open for support in events like this. And I know time is not on our side. I thank you all for coming, and then hope to see you all again in the next event of the association, that is Sonamza or any other. And I would tell these RN students, please, you have seen that this year GCSU is changing a dimension. We don't want anybody to be behind of any activity of the Gambia College Students Union. As I said, the Students Union belongs to each and every school. And one of our campaign promises that we always said, more especially me, is Gambia College students coming together. Because when you said unionism, meaning students coming under one umbrella and fight for a common goal. And as our slogan said, or our motto said, the Gambia College Students Union, one Gambia College, one people, one voice. And then we need to stand by them. That it doesn't mean that you are in RN here, you cannot have go for events in Birikama. And it doesn't mean that students in Birikama or Basse also cannot come to RN events. Let's mingle. Let's make sure that we are as a family, we join our hands together. We are each other's keeper. Because as I said, if I am sick right now, I go to the hospital, I will meet my brothers and sisters that are from RN or public health. So we need to be each other's keeper and each other's brothers and sisters. I thank you all and hope to see you in our next tournament, that is the inter-school championship. And I hope that the championship will come to RN this time again, because they just recently was RN student. Thank you.
The program, but before we go, yeah. Well, before we say goodbye, we would like to send our sincere gratitude to the invitees, the people that make efforts, even though we were late to start, but they were patient. They were patient, and then they sat quietly and waited for us to start at any time. So, how much do I rate you? Million thanks goes to the Hadigale College, CHN School, the sub-unions of the Gambia College. We're indeed very grateful to have you here. And I believe the lesson we learned here today, we will definitely spread it as nurses. We will spread it in our families. We will spread it within the society and the nation as a whole. So thank you very much thank you everyone, the School of Nursing students. Thank you so much for making up time to wait and, enjoy this presentation. We call it a day. Before we go, we would like to have a group photo, like photo shoot outside, just where the ban is. And also to remind you, to remind you that the Benachin is ready. The Benachin and the juice is ready for us. Also, we have a message. Huh? Okay. I don't think the matter is going to take it. I don't know. Can you confirm it? Or, yeah. People that tomorrow as the... Okay. Still to remind you, as Dr. Jaiteh stated, with the coordinating at Efsth, that there will be free screening going on tomorrow. So as we're all here today, we'll definitely love the turnout, the turnout to be like this tomorrow also. Let us go and grace the occasion with them. Let us go and learn more. Let us go and help our society to make a difference. So without saying much again, there's a march past going on outside, and then we say, this is the end of it. Thank you. Thank you.
If you want to receive monies from UK, Europe, USA, Canada, Switzerland, and the rest of the world, Supersonic's money transfer has got you covered. With the largest payout network in the Gambia, you can now receive your monies anywhere you are, from Kartong to Koina, with less hassle. Yes! You can receive monies from your family and friends in UK, Europe, USA, Canada, Switzerland, and the rest of the world with our safe, secure, fast, and convenient service that offers you the largest selection of payout locations in the Gambia. Supersonic's money transfer. We are currently in 34 African countries and counting, giving you quality money remittance services that are second to none. Visit the Google Play Store or the Apple Store today to download the Supersonic's Money Transfer app and enjoy excellent money transfer services only with Supersonic.